fears of further escalation between India and Pakistan after last week's deadly attack on Indian tourists in disputed Kashmir. India says those attackers had Pakistani support. It's a claim that Pakistan denies, but the situation has triggered military activity on both sides of the border. And the people of Kashmir continue to live under constant pressure, facing not just the possibility of physical danger, but also deep emotional and psychological stress.
Pakistan's military is on high alert, conducting intense drills across land, air and sea. Military Chief General Asim Munir has warned of a swift and resolute response amid concerns of a possible strike from India. Delhi blames Pakistan for last week's deadly attack in the town of Pahalgam in Indian-administered Kashmir. Pakistan flatly denies any involvement. Islamabad is also emphasizing restraint, urging the international community to step in and help prevent the crisis from escalating further.
Pakistan does not seek escalation. This has been made clear by the political leadership of Pakistan and at all levels. At the same time, we are fully prepared to defend our sovereignty and territorial integrity. Should India resort to aggression, Pakistan will exercise its inherent and legitimate right to self-defense as enshrined in the UN Charter.
The Indian Air Force has also been carrying out training exercises. India is under intense domestic pressure to respond forcefully to the Kashmir attack. Delhi has long blamed Pakistan of supporting militant groups that target India, allegations that Pakistan denies. Delhi says its security forces will track down everyone involved in the attack, promising that no perpetrator would go unpunished.
If someone thinks that carrying out a cowardly attack is their big victory, then understand that this is Narendra Modi's government. No one will be spared. It is our resolve to uproot militancy from every inch of this country, and we will accomplish it.
The United Nations, the US, and several other countries are urgently calling for calm between the two nuclear-armed neighbors. The UN has warned that any miscalculation could have catastrophic consequences for the entire region. Both Pakistan and India claim all of Kashmir. It's been at the center of almost every major conflict between them and has led to the loss of thousands of lives.
And beyond those numbers lies another kind of damage, the long-term emotional and psychological toll of the people who were caught in the middle. For more on this subject, let's bring in Dr. Saiba Varma, a medical and cultural anthropologist at the University of California, San Diego. Welcome. I understand that your research looks at how violence and healthcare intersect in Kashmir. How do flare-ups like the one we're seeing now affect people's everyday lives and also their mental health?
So I think that this is a really important question for us to consider. Often in this conflict between India and Pakistan, it's the people in Kashmir who get left out of the conversation. But this is a 70-year-old long conflict. And we've seen people in Kashmir bear immense physical but also psychological tolls as a result of this chronic instability. We have skyrocketing rates of PTSD, trauma, anxiety, depression in this region that are directly related to the political instability. I think we're in a very dangerous moment now where this tragedy that happened in Pahalgam could easily escalate into a broader conflict. And unfortunately, it will be Kashmiris who bear the brunt of it.
And even as things stand now, you have described Kashmir as living through an epidemic of trauma. What are the consequences of living through a situation like that?
Well, what we're seeing are just generations of people in Kashmir suffering from all kinds of mental health problems. And many people on the ground actually recognize that these mental health conditions are not just the products of, neurological or biological problems, but they're directly related to living in a situation of chronic instability, when you are afraid of leaving your house, you don't know if you can send your child to school, you don't know if there's going to be a curfew or a strike. All of these things have a massive effect on people's psychic well-being and also on just social well-being in general. And we see that, this of course spills over into the conflict, because the longer both parties deny this problem and are unable to treat it, the more likely it is, unfortunately, that we're going to see these episodic kinds of, horrific violence occur in the region.
And are there any resources available to help people with this? I mean, is it possible under these circumstances to provide the help that they need?
That's a great question, because I think you've hit the problem, the nail on the head there, because India already has a very under-resourced public health system. Mental health in particular is even more of a neglected part of its public health system. In a place like Kashmir, you only have one psychiatric hospital that's serving more than 6 million people. You do have international NGOs like Doctors Without Borders and others who have been trying to provide psychosocial care in the region. But what often happens during these times of instability is that care itself stops. So because of political disturbances, strikes, curfews, you're not able to get medicines in, people are not able to visit the clinic. There are all kinds of ripple effects that prevent people from accessing the very little care that is available.
Well, thank you so much for speaking to us on this important subject. It is Dr. Saiba Varma at UCSD.
Thank you.
Let's get more context now from DW reporter Beenish Javed. Beenish, Pakistan has been saying for days now that it has intelligence that India will attack. Is there support in India for a military strike against Pakistan?
David, Pahalgam attack was exceptionally brutal. There are reports that the 26 people that were killed, many of them were shot in the head, and they were all civilians. Most of them were tourists from different states in India. So definitely in India, this is being seen as tragedy, and that has really struck the nerve of Indians. And therefore, and also politically, the Indian government has expressed that they will take like a defiant, they will be defiant, and they will go after the attackers, and they are blaming Pakistan of being behind this attack. They have linked this attack to Pakistan, and in this context, we do see a large, at least it seems that there is largely support, and the Indian public will back the Indian government if they take some sort of military action against Pakistan.
What about Pakistanis? Is it the same on the other side?
So Pakistanis right now largely believe the narrative and the point of view of the Pakistan's military and the government, which is that Pakistan had nothing to do with this attack. And they are furious and worried and also angry at that why their government is being linked with this attack. We also have to see the context, David. War is the last thing that Pakistanis want right now. It's a country that's still recovering from a very severe economic crisis. Young people are worried about their future. They're worried about political instability. One of the most popular politician in the country is in jail. Many in Pakistan believe that the military is behind his ouster, former Prime Minister Imran Khan, and also of political instability. Many believe that the government is not representative, that the last year elections were unfair. And in this context, of course, there are dents or there are fault lines within the country. But now what is happening with India, there seems to be a unified response, or there seems to be unity behind the government at how they will deal with this situation.
And with these rising tensions, people on both sides are already feeling concrete consequences of these tensions.
There have been devastating consequences on the ground. So in Indian administered Kashmir, of course, because of this attack, tourism has been badly hit. So livelihoods of people have been hit. We see also in Pakistani administered Kashmir, Pakistanis are also now not traveling to these scenic and beautiful areas along the line of control because they are also worried if there's an escalation, they could come under fire. And not only that, there have been Pakistani citizens and Indian citizens who were traveling or who were living in each other's countries. And because visas have been cancelled, we have seen that many people had to leave their loved ones, their families, because their visas were cancelled. And we saw heartbreaking scenes at the border. So because these countries there are many people with close familial ties, so we also see these kind of sufferings on the ground.
Do you see any chance for de-escalation at this point?
So that's what is a very difficult question to answer. Generally, Pakistan and India, experts say, do not have a very strong conflict management mechanism between each other. They usually rely on third parties. And we have seen that US, China, several other countries are urging Pakistan and India to show restraint, to de-escalate tension. Both are nuclear-armed countries. And there can be serious consequences. UN has also warned that there could be catastrophic consequences if escalations if there are escalations between India and Pakistan. And therefore, we just have to see Pakistan is reaching out to other countries diplomatically. India is pushing for its case. We have to see how things turn out in the next few days.
DW reporter Beenish, Javed, thanks so much.